Okay, so now that you are 50 years old, we recommend that we begin screening for colon cancer. Guidelines recommend that we actually start at the age of 45 so that we can catch these colon cancers before they are able to spread anywhere else. When they're localized, they're much easier to treat. Prognosis is much better. So there are three main ways that we can test for the colon cancer. The first, most common, is the colonoscopy. The colonoscopy is normally done every 10 years, and it is the most sensitive and specific test for colon cancer and advanced adenomas, which can later turn into colon cancer. The negatives to the colonoscopy would be the bowel prep. A lot of patients don't like the bowel prep before the surgery to clear the GI tract for the procedure. And then there are also always going to be sedation related risks. Those we would review with you in more detail before the procedure. But again, it is only 10 years and it is the best test we have. If you don't want to do something quite as invasive, the next option is the FIT testing, or the fecal immunochemical testing. This would have to be done annually, but you would just submit a stool sample. This is not going to be quite as sensitive as the colonoscopy and not as specific for the advanced adenomas. Again, those are going to be the growths that can eventually turn into the colon cancer and cause you issues. The other test is going to be the multi-targeted DNA fecal testing, also known as Cologuard. This is going to be done every 3 years. This is also less invasive, which is nice, but it is not as sensitive or as specific as the colonoscopy or the FIT testing, and it is going to be more expensive. All three of these are recommended, and you can choose which one is the best match for you. So I will give you some time to think it over and decide which you would like.